Nursing is today a global profession with nurses from different countries working together. English is very often the language they use at work. In this video, you will see nurses from a range of backgrounds working successfully in English. Good communication skills in English are vital to their success, whether talking to patients or colleagues, for example, during a handover. Catherine Wang is a registered nurse working in Australia.
Handover is a bridge of communication. Communication about patients, about your staff, about any issues that related to your patient case. And handover also provide an oral culture for nurses to address any issues with the patients or ventilate about their stresses, about their nursing care, or a time for basically to connect with your staff and connect with your patients. So handover is an important time to communicate any significant information about your patient cares. For nurses whose English is a second language, it's important to communicate as clearly and accurately as possible. So we use simple and short sentences. Sometimes I think it's very helpful to write it down. So write anything down that's important to our patient care. Also, I think we have to work on our pronunciations of medical and technical vocabularies.
So, in the handover, it's essential to communicate as clearly as possible. Make sure to listen actively, clarify immediately if you don't understand, and use short, simple sentences.
Good morning, my name is Catherine. I'll be working this morning.
Hi, I'm Nelly. How are you today?
Good, not too bad.
That's good.
And how was your shift?
Was good. Busy?
Yeah.
Okay, let's do the handover.
Okay.
Yeah, we had a new admission last night. His name is Daniel.
Okay.
He's 22 and he's insulin-dependent diabetes.
Also, that's type 1 diabetes?
Yes.
Okay.
Yeah, and he came here for hernia reduction.
Okay.
His operation is today at 11, and his doctor is Dr. Olides.
Oh, sorry. Can you just spell that for me, please?
Yes, it's Olides.
Olides. Thanks. Thank you very much for that.
And he's fasting. He's been fasting since midnight.
All right.
Yeah. He had a shower. He's pretty much ready for the operation.
Great. Thank you. Yes. Is he a compliant diabetes?
Yes, he is. But we're keeping an eye on him, so we check everything for him.
So he got his own insulin pen and doing his own sugar level. Excellent.
Yeah. Do you want me to show you around?
That would be really good.
Yeah. Okay, let's go.
Not too much. Not too much.
Yeah, that's good. This is a clean utility.
Okay. So all the dressing and all the needles and syringes, all that. Excellent. Okay.
And this one is dirty.
All right. Pen, when you make your first contact with your patient, I think it's important you establish a caring relationship. This relationship is built upon by asking their histories, their concerns about hospital stays, or their concern about the task that you're going to do to them. And while you're doing the task, you can also ask relevant information that will help to carry out of caregiving tasks. To establish the good relationship with your patient, I think it's involved with your verbal and non-verbal skills. And with non-verbal skills, that will include your facial expression, your pitch of the voice, your hand gestures. They all help. At the same time, I think you can involve them with your decision making regarding the care tasks, so they won't feel so isolated. Before procedures, you need to explain to your patients what are the procedures, what is the procedures and what you're going to do to them, and is there any risks that involve any pain and discomfort. Before going to the operations, make sure they understand what is the surgery. Sometimes patients can be so frightened they forgot what they're going to do, and they can forget a lot of things that we have told them before.
It's really important to establish a rapport with your patient and build trust both with the words you say and the gestures you use. When you're doing any procedure, explain what you're doing. Talk to them about any pain they might experience. Before an operation, make sure the patient knows what to expect, reassure them and show that you care.
Good morning, Daniel. My name is Catherine.
Good morning.
I'll be your nurse for the morning. Just want to ask about the surgery. Did you have your shower and shave? Did you have any pins or plates in your body, extra stuff for you to take that off?
Yeah.
Excellent. Can you tell me more about your diabetes?
I'm insulin dependent.
Yes.
I was diagnosed with it when I was 4 years old, and it's all under control. I go to the clinic regularly.
So you don't have no worries, no concerns, have a lot of information about it,
Yeah.
ask a lot of questions if you
Yes.
need to. Good on you.
Yep.
Just a little bit tight when we pump up. Make sure everything's all right for you before you go. Just going to take a set of temperatures through your
Yep.
ears. Good. The magic sound. Now, the good temperatures. Just take your pulse. Just make sure everything's all right for you. Now you have a slow pulse here. Did you
Yeah.
exercise a lot?
I'm a runner.
Okay. How often do
Yeah.
you run?
I run every day. I'm part of a squad, so
Yeah.
Yeah.
Do you, so okay. So you go and running with a lot of people.
Yeah.
Must be a lot of fun, hey?
yeah, it is.
Yes.
Yeah.
Good on you.
How long until I get to go back, do you think?
After the surgery, usually take about 4 or 6 weeks
Yeah.
to recover yourself, and but it depends individuals because some people recover quickly than the others,
Oh, okay.
and also depends on your wound and there's any complications. But I would recommend you gradually increase your exercise level, and then you can feel comfortable about yourself and about the surgery. And then you have no pain, no other dramas, and you can get back to exercise as much as you can.
And will there be much pain after the surgery?
Well, for every surgery, there will be a certain amount of pain. But we make sure you are not in severe pain. So we will assess you every hour and make sure you get enough pain relief medications. And so we actually adjust the pain relief medication according to your pain level. Of course, we want to make sure that you are comfortable on the bed and you have not suffering too much pain.
Yeah.
Just let us know if you have any concern about the pain after surgery. Okay?
Sure. There was one question that I wanted to ask. My girlfriend and I have sort of talked about, because the surgery's in this region here, if there's any, will there be any problems, or how long after the surgery until we can be active again?
You mean active in terms of intimacy?
Yeah.
Okay.
Yeah.
Good questions. I think a lot of people are concerned about that issues. Once your wound are clean and no problem, and it all depends on your wound about your surgery. Once there's no problem and you get back to normal, then you can resume your sexual activities.
Sure.
There's no problem. So just if you have any other concern as well, just talk to your surgeon more about this. But I think a lot of time when people get back to their normal strength, they can do anything they like.
Okay. And will there be much scarring in the area?
With the scarring, because your surgery is a keyhole surgery, which is a very small area of surgery. Of course, it depends on your surgery skills. And so once if the wound is clean and no problem, if you look after well, when you get home, the scarring should be just very small. You can't even notice it. But if you have any other concern about that, please talk to your doctors as well.
Okay.
Yes. So do you have any other questions you want me to ask me? Or
I don't think so, no.
okay. Your observation looks good. There's no problem. And I'm just going to do some paperwork.
Okay.
And I'll come back and check on you a few minutes later. All
Okay,
right?
sure.
Okay then.
Okay,
See you later.
Thank you.
Good afternoon, Catherine. How are you?
Not too bad. How are you? Good to see you, Mary.
Yes, nice to see you too. How has your morning shift been?
Oh, it's been busy, but it's been
Alright.
pretty alright. Yes.
Well, you're lucky you're going home shopping, aren't you?
Of course, of course. Now I'm going to hand over a patient to you, and his name is Daniel Jones. Daniel is 22 years old, and he had a surgery this morning, and he had a hernia reduction. Now he has a type 1 diabetes, and since he was 4 years old. Now he come back at around 3 o'clock in the afternoon. Now he's has no drama during the surgery and come back with the drips and the dressing. No drain. The dressing looks good. Patent inject pain on my shift. Now he's has medication, pain medication written up for him. So just ask him his pain level and refer to the chart. Now he's pretty stable. His observations are pretty good.
Okay, Catherine, let me go through and summarize
Okay.
what you've been through. Okay.
No, he's 22. Sorry.
Oh, okay.
Yeah.
Age 22.
Yeah.
He's got a history of diabetic type 1, which is insulin dependent, right?
Mm-hmm.
Okay. He's undergone hernia reduction.
Yes.
And it's just returned from the surgery at 3 p.m.
Yes.
Okay. His condition is generally stable,
Mm-hmm.
and he can go home if everything's okay.
Yes, that's right. I forgot.
Okay.
Sorry about that. I forgot to tell you that he can go home if everything's all right. So just check on his sugar level and pain level,
Okay.
and check on the wound if there's any problem. But
Okay.
if there's no drama, you can send him home.
Okay. He's got the medication written on the chart for the
Yes.
pain.
Yes.
Okay, that
Okay.
sounds great.
All right,
okay.
then. Let's go and check him out.
Okay, let's go. Good afternoon, Daniel.
Hello.
I'm Mary, and I'll be your nurse for this afternoon.
Okay.
Now, how are you feeling?
I'm okay. I've got a bit of pain down in the area where the operation was. It's fairly
Okay.
sharp.
Let's see. Put the wrist back down.
Is there something that I can take for the pain, perhaps?
Daniel, I'll have to check the chart
Yep.
to see if the doctor has prescribed something for you to. Now, yes, the doctor has prescribed a painkiller for you.
Okay, yep.
Okay.
Okay. There's no major problems.
Daniel, we don't have to worry about that right now, okay?
Okay.
We'll have to talk to the doctor about that
Yep.
and see what he has to say.
Yep.
But right now, I need to get you some painkillers. See you soon.
Thank you.
all right? Oh, okay. Hi, doctor. I'm Marion Watt, the patient who had an hernia operation this morning. That's correct. Yes. Would you like to come down? Oh, okay. So you want us to keep him in until... That's fine. Okay. I shall communicate that to Daniel. All right then. Now,
Much better, thank you. It's not half as bad as what it was before. So.
that's very, very good. I'm
Yeah.
glad to hear that. Okay, I've spoken to the doctor
Okay.
about the blood sugar level.
Yep.
Now everything's fine, sugar level and the pain.
Okay.
Is that okay with you?
Yeah, there's no major problems or anything?
No,
Okay.
before we send you home,
Cool.
okay? Now, is there anyone you need to contact? Anyone you
Yep, this afternoon, so I'll have to let her know. Thank
okay?
you.
Otherwise, everything's fine. You don't have to worry.
Okay, thank you.
See you.
In conclusion,
Nursing is about caring for people from all sort of different backgrounds. Sometimes in the most extremely difficult circumstances,